Good morning and welcome to our live weekly question and answer where we sit with an integrative doctor. Sometimes we have guests as we did last week, and we look for your questions that you can post in the chat section. Should be off here to the side of the screen. You'll need to be logged into YouTube. You can post your questions there. If you're not able to log into YouTube and you have questions for us, you can go ahead and email those questions ahead of time to us. Our office email is office@tlcdoctors.com. That's office@tlcdoctors.com. And actually, I have a question that was emailed in here too. So the way this works is we normally bring a topic or a couple topics, current events and news, to sort of fill the time as we wait for your questions. And then I'm here monitoring the questions in the chat, and I'll ask our doctor those questions. If you didn't get a chance to watch last week's video, I encourage you to go back and watch that. We were joined by a cardiologist, Dr. Shulian, that we've worked with for many, many years, and we refer our patients to him as a specialist for cardiology. He got to speak a little bit about integrative cardiology, which he has now changed his practice and getting to lean a little bit more into prevention, which he's become more and more passionate about instead of just seeing and treating patients that are acutely ill, and now it's time for medical intervention, usually surgery.
Yeah, he was in what they call interventional cardiology,
Right.
waiting for the disease to develop and do the catheterizations and open heart surgeries, and that's always, sad to
Right.
wait until you have a disease.
Mm-hmm. And that's one of the things that we're doing here, trying early on with patients before they reach those endpoints in their disease process to reverse their chronic disease.
Right.
Because we can do incredible things with their diet, lifestyle, looking at their nutritional deficiencies, exercise,
Right.
proper hydration. Okay, well, why do you say we jump in and answer a couple questions?
And when I answer questions, again, this is not meant to be personalized medical advice. This is general answers to these questions, and you're welcome to call us and make an appointment at Tustin Longevity Center, 714-544-1521, or text us if you want a personalized, response. But these are giving you an opportunity to ask a doctor, an integrative doctor, how we would try to approach a disease management collaboratively with your specialist to get a better outcome. This is not to replace the need for specialists, but it is to collaborate and get a enhanced or improved results.
Thank you, Doctor. So we'll go ahead and start answering a couple questions, and then as we wait for more, Dr. Ellithorpe has some information for us on a ton of work that she's been doing to really make a case for chelation therapy.
Mm-hmm.
Okay, so first question today comes to us from Emmanuel. And Emmanuel asks, good morning, when counting carbs, is it better to count from the nutrition label, a book, or an app?
Well, whenever you're being requested to purchase something, the tendency of the sales department of that vitamin or that food product is going to be biased to the product, and there may be some tendencies to not report accurately the carbohydrate content and such. I mean, you're kind of stuck with what they say unless you can go to a lab and have it officially tested. But essentially, there is a book called Corinne Netzer, Netzer, and she wrote the Encyclopedia of Food Values. That is the Encyclopedia of Food Values, and all the foods in general by category have been tested, and their caloric, their carbohydrate, their fat, their protein content, their mineral and nutrient components have been listed, and this is what I use. If you come to my office, as I look here, it sits on my desk and I refer to it all the time. So if you want authoritative responses, you can get Corinne Netzer's Encyclopedia of Food Values. I do think that the internet is a reasonable source. There's no bias probably there to look at the actual carbohydrate content, protein.
And most of these apps are basing their counts of calories and carbohydrates off of a database that has now been very well established. So I think you can trust some of these apps, and I don't think we want to get so minute that we're splitting hairs on, is this 51 carbs or 52 carbs?
Right.
We want to see trends over time, right? And we want to be aware of the amount of carbs that we're eating, because I think the first step to change is knowledge and awareness.
Yes.
Most of our patients, would you agree, have no idea the carbohydrate load, the sugar load they're putting on their body on a daily, weekly, monthly basis.
Right. And the mislabeling, there are maybe 56 different names for added high fructose corn syrup.
That's
So,
our fun. If you
It's
could
in
find
my
it
drawer.
somewhere.
It's in
Sorry
the
about
drawer.
Here.
I think it also depends on the type of food, right? Because if you're buying something that is packaged and prepared and processed, it's going to have the nutrition facts on the side of the box. But if you're going down the aisle and you're looking at bulk grains or vegetables or fruits, well, they're not going to have a sticker on the side with the nutrition facts. That's where you're going to have to lean on the internet or an app or a book like Dr. Althorp has suggested.
And we have to do this because there is so much obesity in the United States, chronic disease from obesity. It's considered a disease now. And I do have a image on this. I think that might be beneficial. And that is chronic diseases in America. This is from the Centers for Disease Control, where it states 6 in 10 adults in the United States have a chronic disease. And they list primarily the leading causes of death and disability to drive the nation's $3.5 trillion annual healthcare costs are heart disease, number 1, cancer, number 2, chronic lung disease, number 3, stroke, number 4, Alzheimer's disease is now number 5, diabetes, number 5, and chronic kidney disease. So heart, cancer, lung, stroke, Alzheimer's, diabetes, and chronic kidney disease. So yeah, that's 7 they listed there. And so it's a good question to ask about carbohydrates and the reliability, because we have to start looking at this. This didn't happen by accident. We have all become in the United States fattened up by the grains.
Right. And to your point that you were making originally when you first answered this question, you do need to pay attention to the label and look at serving sizes, because that's where they can be really sneaky. There can be a food advertised as no added sugar, and then you read the ingredients in the label and you find out, well, they're using juice concentrate, so they're taking out ingredients to squeeze in more calories to make it taste sweeter. Or the serving size is, let's say, half a bar, and you're opening up a bar and eating the whole bar thinking that that's what you're getting, the carbs in the whole bar. So you have to pay attention.
Correct.
Because they've got sneaky ways of making the label look better than it is for competition.
Another thing you have to remember is there is no essential need for carbohydrates for nutrition. Our bodies can create our own carbohydrates. We have what is called gluconeogenesis. And so the essential daily requirement for carbohydrates is zero. And you would think, if you look at a government-based food pyramid, that it's the foundational base of the whole food pyramid, not to mention all the other carbs that are in the rest of the part of the pyramid. And so this is junior high training that should be taught to everyone.
Yeah, I feel like a lot of people, even in the medical profession, of course they're not really trained on this, still they would be shocked to hear that the nutritional daily value of carbohydrates to survive is 0.
Right.
They would take not offense to that, but they wouldn't understand that. Okay, great question, Emmanuel. I'm going to move on to the next one. This is going to be from Andre. Andre asks, the reports are blood type A people are 45% more susceptible to getting coronavirus. What can they do to protect themselves more than blood type O people? It's interesting. I haven't heard that, but are we surprised? Blood type A has trouble.
But I brought this up early on. We started these videos concerning the COVID-19 virus in January. And there I pointed out that the A-type blood does matter. And I've been saying this for decades. Why would that be? Well, each blood type confers a genetic house that you live in, so to say. And the house of A-type blood people have a weakness in general for digestion of fats and proteins. Therefore, A-type people typically become your vegetarians because they inherently have problems with digesting heavier, more nutrient-dense proteins and fats. And that makes sense if they don't have digestive enzymes for it. So I have compassion for them. I understand this. That doesn't give the medical community excuse, though, to not know this, and rather to inform and find out at birth what the blood types of the babies are, so that much of the colic and the little childhood tummy issues and constipation, diarrhea, food sensitivities, and all the maldigestion problems that will emerge. If you don't digest your food well, then you can't get the fractions and particles that you need to build your vitamins, to build your cell membrane, to stay well. Therefore, ions and minerals even are poorly assimilated. So the poor A-type blood people as a class, now some are worse than others, okay? But in general, even in my practice, the vast majority of my patients are A-type blood. I don't advertise for A-type blood patients.
Nor is it even the most common blood type.
Right, it's not even the most common, but I'd say easily 80% plus of all my patients are A-type blood. That's because they have been missed by the poor education of the medical community on prevention and diet and nutrition and its impact rather than using
and they come to us saying, I've been to 15 doctors and nobody can figure out what's wrong with me.
Yeah. So it's not that I'm saying I don't need a specialist, I do. And I need to refer when it's beyond the capacity of a general family practice management level. But the vast majority, I think, could be prevented. So look at, if you need zinc to help you prevent the RNA replication, and you're a blood type A and you can't digest well and assimilate zinc and things like this as well, then you're going to be at a disadvantage. If you are an A and you can't make enough of your B vitamins to handle stress and you go into a cortisol stress response, then you're going to have a depressed immune system and be at a disadvantage for COVID-19 or any other virus. If you are a blood type A and you don't eat enough fats and have enough cholesterol in you, and the sunlight, I'm telling you, the sunlight is not enough today with all the spraying of the chemtrails that have aluminum oxide, barium oxide, strontium oxides, these kind of things that reflect back the ultraviolet light that needs to hit the skin to help make vitamin D, which is a fat-soluble vitamin. And if you can't, as an A, make enough fat, digestion, cholesterol for the sun to help you with your vitamin D level, you're going to be at a disadvantage. And of course, the recent papers coming out now are revalidating and exalting vitamin D as a great and valuable predictor of the course that a COVID patient will go. I think they clearly found that if you're under 35 international units in your blood, microliters per deciliter, that you are going to have a poorer outcome. So you can see then how A-type blood, your blood type, matters. We need to help the medical educational program of our state's medical schools do a better job with nutrition and preventative training.
We have a really good product from Orthomolecular. I think it's called IG Protect or something with immunoglobulins. Mm-hmm. We have NK Immune, mm-hmm. which is our very strong comprehensive immune formula, vitamin D supplementation, mm-hmm.
And
then a good multi like the TLC Energy Core, mm-hmm. or the Orthomolecular Mitocore.
And I still today, we are now 4.5, almost 5 months since this all emerged, and I still don't have any patients, and I have lots of cancer patients, diabetics, chronic heart disease patients, autoimmune, immune compromised patients, elderly patients, a lot of Medicare patients, and there has just been no problem with any of my patients. We have sailed through this beautifully. We've had no problems. Why? Because from the minute you come to an integrative general practice, we are looking at what could happen, how can we prevent anything from happening. So we do micronutrient assays with SpectraCell. We do vitamin D levels, and we've been doing them for decades, not recently, and I do thank my colleagues for starting to get on the train and starting to do some of these studies. Another thing is the hydroxychloroquine from the Veterans Observational Studies was vindicated and validated as having significant preventative value. That is an FDA-approved drug for malaria and certain rheumatidity diseases, arthritides. And that has now been elevated, and the false reporting that was published in the Lancet and the New England Journal of Medicine about 2-3 months ago now has been retracted. So you see, we have to realize that prevention matters, and that you have to look at science and look at the research and look to your doctors to really get into research to find these trends and understand that hydroxychloroquine, for instance, would never have been used for the past 60 years if it wasn't a basically safe medicine. And I've been around people and prescribing hydroxychloroquine for decades, and I've never had one cardiac event. So when that criticism came out on it, I became very skeptical about the authors of the articles, if they had a bias. I started looking to see if they had any financial relationships with other solutions that they would want to promote, and not something as tried and true as good old hydroxychloroquine for the past 60 years. I mean, unfortunate to say, you have to look at biased, and this is a element, an ingredient in scientific research called bias, and that's a factor that scientific papers have to address.
Right. Okay. Thank you for that question, Andre. And our next question comes from Marie. And Marie, we also got your question on email, so thanks for sending that in. We knew this question was coming. Dr. Rita, can you please clarify the mask thing? I know it's a mandate. Does it help? Who, the wearer or others? Should a healthy person wear one? Does it protect others? Does it hurt the wearer?
When I was on active duty as a physician, I was in charge of an airfield, Goddard Airfield at Fort Knox, Kentucky. And there, the hangars were there, and it gets cold in the winter, and you have to shut the hangars. And I had to keep the pilots and their families in ready state of health at any moment if we needed, our pilots to have to fight a war. And one of the things that we had to do was measure the air quality in the hangars and the room there. And we had to do sound measurements for protecting their hearing and so forth. This is all prevention. And we found that when the JP4 jet fuel and fumes were large, the O2 oxygen saturation in the hangar would drop. And we know the stats on that. Normally, air oxygen is 21 to 22% saturated with oxygen. If it drops to 19.5%, this is an EPA danger zone associated with ill health, associated with, let's say a pilot has to make a quick decision and the oxygen tension is dropping to 19.5% or lower. His ability to cognate and make quick critical decisions with these multi-million billion dollar, Apache helicopters and stuff is critical, and lower oxygen tension will harm those critical decision-making dynamics. We know that if you take a mask and you even have a thin mask, we're not talking about a sealed N95 mask. If you just take a typical mask such as this, and you take the oxygen room sensor and you put it right by your mouth right here, to the right of your corner of your lip, it'll be 21-22% in the room. If you put the mask on and you put the sensor as if it's right in there, it'll drop to 17.5%. That means everyone who is rebreathing their CO2, their exhaled virons and particles, because breathing out is a method of cleansing, you know? You are breathing in too much CO2, you become hypercapnic, too much CO2 in the blood, you become acidic, and your cognitive abilities diminish. And we've known this since, you know, since I was practicing medicine in the late 70s.
Is that an acceptable risk factor, though, to possibly, because we haven't spoken yet about preventing viral spread?
Well, if you make people wear a mask who are well, and you make them more acidic and hypercapnic and lower O2, you promote, because acidity is an environment for viral replication. Now, I'm just talking science, so I'm throwing back to you, Maria, the data, okay? All I can do as a physician is tell you the science does not indicate that this is the right thing to do. Now, we do have a body of science that has looked at healthcare providers who have to wear masks for prolonged periods of time, surgeons and stuff doing critical surgery and all. And we have found in studies that are published, I have them in the back there, I didn't know I was going to get this question, but they report headaches and malaise and cognitive diminishments and fatigue, you know, and exhaustion. So we have the science, we have studies that say wearing a mask has measurable harmful effects that take a healthy person into a state that puts them in a better position for viral growth to succeed.
Right. Yeah, we know, like in our state, California, right now, they're requiring it in any public places. So I'm putting on my mask, you know, when I have to, when I'm around people less than 6 feet, but I try to keep it off as much as possible. We're requiring the staff here at the medical office for our patients' benefit to wear it. But I think to your point, the research on its effectiveness is spotty at best, right?
Yes, there isn't any science
proving that it's preventing
right,
the spread. I mean, I've heard the analogy of it's like trying to use a chain link fence to prevent mosquitoes coming into your yard. Right. Because these masks, we're not using them what they were designed for. This is a surgical mask. This was designed for being used in a sterile environment for a short period of time. The longer I wear this, the more it gets saturated with the moisture of my breath, the more it's trapping bacteria and viruses on it. So really these were designed to be used for short term and then replaced. The other popular type of mask out there is an N95 mask. And that mask is designed to be worn in a contaminated environment, but its effectiveness against viruses and bacteria is shoddy at best. It's meant to be used where there's, you know, things in the air, chemicals that are being breathed in to help block that out. But in an N95 mask, you're blowing out through an air hole.
Yeah.
So the guy at Target that's wearing the N95 mask isn't preventing the spread of coronavirus because he's blowing it right out through there unfiltered. Right. The air he's breathing in is somewhat effectively being filtered. And then, of course, the last type of mask out there are the homemade masks, things from T-shirts. And I mean, it's kind of silly to even talk about. There's no data at all to show that something that is as porous as cotton is doing anything to stop anything, except maybe some spitlet or droplets from your mouth.
Yes, and I've been practicing now 40 years, and I have been through, even before medical school, during Woodstock in 1968, we had the swine flu or Asian flu come through, and did well through that. We've been through so many SARS-2, the Ebola concern, H1N1, the Zika virus. All these issues have come and gone throughout time. I have never seen any lack of good outcome by the population not wearing a mask. We all know that if you're sick, go home from work, okay? Mm-hmm. If you're sick at school, go home. We all know to cover our mouth when we cough. We all know to wash our hands frequently. This is common sense, and there is actually no science to validate these requests. I am not saying not to obey them because you didn't elect me to make the rules. But I'm just giving you the science that does not exist to support these mandates. I'm giving you the known science that it does exist, that masks do produce hypercapnia, hypoxia, reduced O2 saturation levels that are clearly below EPA safety guidelines. And so I here at this place have such a wonderful, healthy population, even in my elderly patients. And it's prevention. We don't need to be stressing over a mask. We need to be saying, are you watching your carbs? Have I been saying that for 20 years at this
Just
location?
a little bit, yeah.
Drink your water and stay hydrated so you can physiologically eliminate through your urine and through your bowels and sweat better. I've been saying that here. I've been testing the D, replacing the D. I've been cutting out the, telling you to sleep good and trying to get a good night's sleep to replenish your immune system. I've been giving multivitamins that have zinc in them. I've been using Juice Plus that it has 42 different peer-reviewed articles, including my own, about building up your antioxidant shield. And we know that the SARS-2 COVID-19 virus has a cytokine oxidative stressful storm with it, and it is that immune storm stress that is so detrimental and clot producing. Well, the water helps, the enzymes we give you help, the D helps, the zinc we've given you help, the low carb diet so you don't get a sticky blood, the good night's sleep, the drinking extra water, taking things like Juice Plus to build up your immune system. No wonder my patients have done so well. And California in general has done very, very well. And I think that's because all the shelves sold out on the vitamin C and the vitamin D and the zinc supplementations within the early parts of February here. And so, no, let's talk about where it matters, prevention. My patient base is evident of this. California is evident of this. Many countries have opened up. There's certainly their schools, like in Sweden. They weathered this and they really did no restrictions and mandates other than common sense. And they fared about as well as any other nation. We know Australia is opening up their schools. We know France is now opening up their schools. The children are at very, very low risk. And we have now nations that closed. We have nations that open. And we're not seeing any real statistical difference. But I tell you, I have seen a lot of emotional stress, anxiety, suicide, requests for antidepressant medications, anti-anxiety medicines. And anxiety reduces your immune system.
That's right.
So, no, I have great criticisms of what I've seen done with these state-mandated rules.
Yeah. I know me and my family, we're trying to take an active defense against the onslaught of information and the sensationalism of everything. Not to say don't pay attention to the news, but I think today it's just too accessible to us on our smart devices, on our phones, at home, on the radio in the car, and I can just feel my anxiety going up as I'm hearing report after report after report of the same information over and over again. Stress is a big factor.
And the death rate is, for the past 9 weeks, down. And we know 50% of that was our elderly, in the nursing home primarily. And so I think it is illogical and reflects the lack of preventative care and nutritional teaching in our healthcare system that uses such draconian, superficial mandates. I think they're just uneducated.
Okay. Well, great question, Marie, and I'm sure there's a lot that we could talk on right there, but just saying that what we do know, what we do have the research and the statistics on, is the prevention.
Right.
The masks, definitely questionable at best, certainly not in the capacity that we're using them. Well, folks, we spent a lot of time on a few questions today, but I tell you what, we will save these questions If you join us next week, we'll pick right back up with the questions that we did not have time to get to today. So join us again next Wednesday at 9:45 a.m. Pacific. Oh, and you see what Dr. Elthorpe has? This is what she wanted to talk about today.
This is what I wanted to talk about today. We're going to post a article that I have written. Okay, it's about one of the most unique FDA-approved drugs for the past 70 years that has been overlooked, much like hydroxychloroquine. Please, I beg you, when Blake posts this, please go to our website. It'll be on our website and attached to this. Read it. I implore you to reduce that $3.1 trillion healthcare costs. I beg you to read this.
Okay. So give us a little bit of time, but we will put a link to that.
And it's supported.
Yeah, just
it's a little bit supported.
We'll put a link to that paper that she's talking about in today's video in the description of the video. You can click on that link. We'll also include that in our next email that we send out to our patients as well. Okay. Well, thanks again for joining us. We went a little over today. I got to get Dr. Elthorpe ready for her patients today. Join us next week at 9:45 a.m. Pacific time here on Wednesday, and we look forward to answering your questions. We'll start with the ones we didn't get to today.
Click, like, and subscribe.
Yes, please. That does help us out. Thanks,
All right.
folks. Thanks for joining us.
All right.